Welcome to Health Education England's Maternity Transformation webinar. My name is Alison Smith. I'm supporting this piece of work. HEE has launched a £1 million transformation fund to help local maternity systems and organisations implement the Maternity Support Worker Competency Education Career and Development Framework. The framework was produced in collaboration with key stakeholders and was launched in February 2019. The purpose of this webinar is really to try and provide some help and guidance about the process of undertaking this transformational piece of work. We will hear today from June Mensah, who was part of the team from North West London, who has actually piloted this successfully. But first of all, I'm going to pass you on to Denise Linne from the Royal College of Midwives, who's actually going to talk to you about the development of the MSW role and how it's led to where we are today. Thank you, Denise.
Thank you, Alison. I'm absolutely delighted to be here and talking to you. The RCM has been fully involved in the development of the framework, and so we are delighted that this funding is now being made available for it to be implemented across England. I've been involved in the MSW agenda for about 14 to 15 years, and that was acutely came into focus for me a couple of weeks ago when, as some of you may know, the RCM is moving office. Probably not the best time to be moving office, but part of moving is tidying up, clearing out and identifying things that you need to take with you. So I went into the office and cleared out my desk, my bookcase and my filing cabinet, and there was a lots of information, articles, documents about MSWs. And reading some of which I've completely forgotten about, but reading through some of those documents and articles really brought home to me how far we've come in our journey from MSWs being a fairly new workforce 20 years ago to where we are now. So one of the historical documents that I had was the Prepare to Care curriculum, which was developed by the RCM in 2004, which was a curriculum for maternity care assistants, as we called them at that stage, at level 2. Interestingly enough, that was the level that the RCM believed MSW should be kept at. Certainly we've moved on from that. The next thing I was involved in was some research that was commissioned by the Department of Health back in 2007 that was looking at the learning offer for support workers in maternity. And that demonstrated that although there was areas of good practice, the majority of support workers didn't have access to good quality education and training. Where they did have access to training, it was usually in-house and therefore it wasn't transferable. So there was a big gap there. The next article that I found was an article that must have been written in 2010 for the British Journal of Midwifery. And I was a co-author with Richard Griffin, Jackie Dunkley-Bent and John Skews. So I was in very good company there. And this article was about the development of maternity support workers in the UK. By that time, we had frameworks in Northern Ireland, Scotland and Wales, and we were doing some good work in England, but we didn't have a national framework. And certainly I was very involved, and the RCM was very involved in the London South Bank Foundation degree at that stage. But one of the key points in that article was that, and I quote, "While increasingly accepted, MSWs are still not an established feature of the NHS workforce. Establishment is the final stage of the development of a new role." Moving on to a few years ago, I think 2017, again the RCM commissioned some research to support the development of this framework. And in that research, it was identified that the MSW role was accepted and the rate of acceptance far exceeded that of other new roles in the NHS, so was to be celebrated. So I think that may just give you a flavour of how far we've come and how proud I am of being part of that journey. So I'm delighted to be here and delighted that, to be supporting this initiative. So thank you, Alison.
So implementing the HE Competency Education and Career Development Framework for North West London and London LMS. So if we get to the next slide, I'll give you a little bit of the background. So we are a service user that has about 2.4 million in our population. We service about 30 births within that area. The trusts that we work together with, there are 4 trusts with 6 services. So they include Hillingdon, London North West, Chelsea, Westminster and Imperial, having both got 2 sites. We have roughly about 250 MSWs within that catchment area. And this programme started really based on the Better Birth Review and also the framework, and it aligns together with our integrated care service strategy. And we looked at it from end to end. It really started looking at the band 3s mainly because that was the area that Better Birth talked about, which was postnatal. And then we've now broadened that scope a little bit more. So we go to the next slide. So the workforce in general, we have the issues that we found in North West London as we were looking through and researching what we had. We looked at all the inconsistencies of learning and development. So across the sector, within the 4 trusts, which have 6 sites, we all do our learning and development differently. We all have different ways of training. We all have different areas that we focus on. And we had different induction days and the way in which that scope of work was carried out. The workforce were frustrated because they didn't have a planned career pathway. You came into the service, you stayed as either a band 2 or a band 3, and in some areas a band 4. And that's where you stayed throughout your career, unless you decided to move into another field. There was a little bit of frustration there for the workforce. And then there was definitely, we found disparity between what tasks were allocated to what MSW. So we had, for example, we had wound care. There were some MSWs who were at band 3 who worked in the community that could do wound care management to a point with them working with their with their midwife. And then there were some areas that weren't allowing their midwife, the MSWs, to do that. And then also the other tasks such as SBRs and checks like that, working with the neonatal team. Some of the MSWs in other areas could do that. So there was a little bit of confusion in what should and shouldn't be. And we did have some guidance there from the RCM of what was the roles an MSW should take on board. And then also the grading. We had trusts who had all band 3s, and then we have trusts that just have 2s and 3s with the occasional band 4, all doing very similar roles. Next slide. So our approach was to look at a kind of framework which was linked with Health Education England. We started off with a focus group, and we had the MSWs discuss with us their role, how they felt they contributed to the service, how they felt they would want to progress. And so we developed some other workshops to have that discussion. We also had a conversation with the maternity voice partners, and these are the women that own the service users. Which we found was really interesting because some of those service users didn't even know what an MSW was and didn't know that was their title. And some areas thought that MSWs were more midwives teamed and that they did a lot of the front-facing work. So it was quite a varied approach to what the MSWs would do and how that was seen by the service. So we formed from that a project group, and we took that information to our local maternity systems and had a discussion on a wider level. And that partnership was with the heads of midwifery, the directors of midwifery, and the services that contribute to the CCGs. And also the RCM sat on that board, and practice development midwives, who are the focus the leads for looking after support workers in their trusts. And we had that discussion and put the information forward to that group. And then we started looking at how a project would lead on from there. So we have these areas that we looked at: the analysis, we looked at a design, we looked at how we could implement it and what that would be, how we could evaluate that for the service going forward. Next slide. So if I break it down for you a little bit about the analysis. So how do we gather our information? We went to each trust and we looked at the whole time equivalents. We looked at what we had in the service, how many support workers we had, what kind of grading they had and the mixture of grading, whether we had full-time or part-time, and how that works with the workforce. We looked at their qualifications, and that was quite a hard task because we had to go to individual MSWs to get their qualification. That's not held really centrally. Our HR teams do have some information when they come in for recruitment, but the general qualifications going on from that we did not have. And then we looked at the job descriptions. Our job descriptions varied. So each trust have their own job description for a band 3, and they all have varying tasks and similarities, but they were all very different. One of the other disparities to that was that we found that band 2 and band 3 job descriptions were very similar. The only element changing from that being the neonatal approach to baby care. Next slide. And then we had the design. We looked at what we should do going forward. So we came to the conclusion that we would focus just on the band 3 at the moment, because that was the area that Better Births was talked about in the postnatal area. But we'd also look at band 2 and a progressing route to band 4 along the line. So the band 2 job description was kind of held, and we focused mostly on the band 3. We then joined together as a team and looked at all the job descriptions, and then collated one job description for a band 3 that we thought all the elements could fit in. We then also looked at a skills passport. That was we looking at their competencies going forward, where that each trust had their own way of looking at competencies and sign off. And we want to collate that in one place so that if there was a transfer, it would be transferable. So if you was at Hillingdon, for instance, and went to work at Chelsea and Westminster, that passport would go along with you, and you would have that information locally that you had all these skills signed off and the training was done. And then we looked at the scope and commissioning of the level 3 apprenticeship offer to all the 4 trusts. And that was looking at whether there was a provider that did a maternity pathway specifically, and how the 4 trusts we could negotiate a way of presenting that for our workforce. And then once we found an education provider that was willing to work with, we then looked at how we could negotiate a levy return. So we would spend the levy to get the commission, but then we'd look at whether our practice development teams could do that training and therefore bring back some money into the service. And when we looked at, sorry, yeah, it's fine, we can go over. And then we just looked at the co-design of that curriculum. The PDMs and the education providers would map that curriculum together and try to put that together formally. Yep, next slide. Yep. Technology. Sorry, just going a bit slow, but that's fine. Is that my next slide? Yeah, so from the co-design, then we also had to look at the Maternity Support Worker Competency Education and Career Development Framework, which was launched from HEE, that had very clear guidance on how what an MSW should be doing from band 2, 3 and 4, and obviously their skills and competencies. So we started mapping our work with that, as they were looking at it nationally. So not just North West London now, and it's just kind of, we had this scope from national perspective. We then had a launch for our own apprenticeship programme in December of last year. And then we had our induction, our job description that was signed off formally by our HRDs. And then we had our competency book that we now developed and that we're working towards. So those are the publications that we are now following, as well as the guidance on the RCM and any other national team's perspective. So next slide. So how have we implemented it so far within the training? So what we have done, we have worked with the education partners to split that teaching content and modify the midwifery options. So in the apprenticeship standard, there are 15 mandatory units and there are 6 maternity options. We have taken those 6 and they stay in the programme, but what we have done is use the HEE framework and taken their 4 domains and added those in as a separate component and added our own new bespoke midwifery option. The education providers will deliver the mandatory part of the apprenticeship programme, and we will deliver these maternity options, the midwifery options. So the practice development team are working together to do that. And what we do is we buddy up with each system. So we have 6 PDMs within the trusts, and what we've done is one PDM buddy up with the another, and we deliver that training across the group. We are currently trialing now an online delivery. So what we had to do within regards to COVID-19 is that we took the midwifery elements and we pushed them back down the scope of the programme and allowed our education providers to continue with their area because they already had an online platform. And then we started making bespoke work at making our midwifery ones online. So we've just delivered last week actually our first online delivery, which was challenging but actually worked out very well. The learners were very engaged with what was going on and they were quite receptive of how we could do it. One of the things that was like a theory session, so what we now trying to work out is how we can do a skills session that would be online and whether there are any other learning platforms that we can use to help us to deliver that service. So that's a work in progress at the moment. We currently review meetings with the PDM team and the education team on a monthly basis to see how things are working. Are the learners engaged? Are they getting the right information? Are we delivering the information the right way? And are there any tools or are there any learnings that we need to take on board to reevaluate the progress of the course? Going down the line, there will be obviously evaluations we've had an evaluation towards the beginning that Richard has already done, and we are evaluating in the middle, and we hope to evaluate towards the end as well, and then that will be in our toolkit. And then we are now considering looking at deployment and how the MSWs will be deployed in their areas following training. This will pose probably a slight difference between each trust, because we have Band 3s all in one sector, so they will carry on probably moving into their area. But for those who are a trust who have Band 2s and Band 3s, we'll look at how we can step up that programme and get them the skills that they have learnt in the different areas going forward. Yeah, next slide. So evaluation. We are looking at economic evaluation of an apprenticeship, which Richard has started doing and has that available via the HE's website, that looks at the costings and how going forward we can implement the service or impact the service. We're also working with a company called Timewise, and we have looked at the part-time MSWs that will sit on this programme. So at current we have a full-time cohort with a few part-time, and we are looking at how working together, the part-time and full-time can work through their training so they don't lose out, and how that will look like as they come out of the workforce. And we've got a survey that is pending results. We can feed back to you at some point. We're also going to evaluate the online learning, what has gone on so far, and how we can further enhance that and make that better. One of the difficulties will be that the trusts, we all have as a sector, even though we're in North West London, we have different training platforms. So we're trying to see how we can link those platforms together and make it easier for us to be able to deliver training. And then we're also going to look at the impact of the Band 3s and their new deployment and how that would affect the service. And hopefully there we should see some changes to the women's expectations, and also for the support to the midwives who are going through and who need the support team to look after that, or to help them to do the care. I think there's another slide there. Okay, so regards to our next steps, We have already been signed off to have a further cohort starting early next year. So we'll start looking at recruitment and how we will pick that up. We're going to look at the band 2 and the band 4 roles now. We're going to see how we can separate that band 2 role and make it very clear guidance that a band 2 role does this and a band 3 role does this, and then have a look at what we can do for the future with the band 4 role, looking at stepping up from a pathway that you start as a band 2 probably, work your way into a band 3 role, which will be your substantive role, and then you can branch out towards a band 4 role in certain areas such as the theatre roles, or you can lead yourself up to a progression to a pre-registration role and look at going into midwifery or nursing, and we're looking at how that bridging gap will be filled. We're also looking at what would happen if you came via school leaver, we're looking at the T levels, and T levels are the equivalent to A levels now, and so that may be a route in maternity and into the health service. And then we're also looking at recruiting and promoting the framework that HE are delivering, and making sure that we can continue to have a pathway for maternity support workers with the service. I think that is my, okay, and this is my last slide actually, about what have we learned. So we have learned that definitely working together and a partnership with all the services. So we're looking at the LMS, we're talking about the practice development, we're talking about the MSWs, we're talking about education providers, and having those conversations regularly and pooling expertise together. That has been really valuable. We're thinking broad, so we're thinking from the beginning all the way to the end and looking at the steps that we can go by. We don't want to just make just fix one area. We want to try and complete that whole journey for someone coming through the service. We are linked with our local maternity systems, and that's also linking with the integrated care service. So we are making sure that we speak to our heads of midwifery, we speak to the whole service as a sector, and getting their feedback and how we can implement the changes to the service depending on what happens nationally. And then we've used our expertise from the Health Education England apprenticeship leads within our trust and nationally to get as much information about apprenticeships as we can going forward. And communication is, I would say, is key. Having those conversations, getting the information, and really researching where we want to go as a service and how we can implement the changes effectively with less impact to the women coming through our service and less impact to the workforce in delivering that care. I think that's my last slide. These are my contact details for myself and Richard. And I think if there are any questions that are posed in the chat, I can try and answer those. I do believe that we had some questions sent to us prior, so I can address some of those now as well. So one of the questions we had was, how do I get my LMS interested? I would say that the first thing to do would be go to your heads of midwifery and your directors of midwifery, because they sit on that local systems board, and they can ensure that you could have a conversation about your ideas for your workforce. And then also they meet every couple of months, so they're responsible for development. So that would be a key area to go to look at, getting on board with that. The other question was, my trust doesn't have contact for a level 3 apprenticeship provider. What do we do? One of the things the first contact will be go to Health Education England apprenticeship leads and have a discussion with them in the region, what's available, and they will have information about apprenticeships on a national level. And also look at your links to your trust apprenticeship leads, which will be on the nursing education side, and they would be able to tell you about what they have or what is available or how we can go about delivering for you. The other question was, what are the cost implications and how do you address them? The cost implications, there are quite a few things that we had to consider. Richard has done an evaluation piece, which is accessible on the website for Health Education England, which will break down all of those changes. So we can give you that document. But I would say that one of the things that we looked at was the vacancy rates, the framework against the JDs, the issues of capacity and capability and improving the service. So it would take, you'd really have to look across the board about the service that you want to provide, where those service needs will be met and how we could structure that change. But the paper has a bit more depth and in detail for you. The other question, I think this was the other question that we had, was where do you start? We brought the practice development team together because we are the ones who look after training and development within our workforce, and we got the data. So we kind of got all our JDs, we got all our competencies, we got all our skills, we looked at the qualifications, we looked at the numbers we were working with, and then started breaking down the areas which we needed to work on. And then we brought that to our heads of midwifery and directors of midwives, and took the research a little bit broader. And we looked at the drivers, the strategic drivers that would help us, and that was obviously the RCM, which was strategic in giving us the information about what MSW should do, should be doing, and why they should be doing it. And then obviously also looking at how they we deploy outwards nationally. So that was some of the questions there. I don't know if there's any other questions that have been posed anywhere before I hand back to Alison. No? Okay, I'll hand back to Alison then.
So I wanted to thank both our presenters, Denise and June, today for all the information that you shared with us, and for you for your attendees. I just wanted to flag with you that I know we had some issues sharing the slides at the beginning, but not to worry. This actual webinar and a copy of the slide presentations will be loaded up onto our website alongside the toolkit that's already there. So you will be able to look back at those slides and have a look at the information that June was referring to. I just hope that you found it useful and supportive. And obviously, if you've got any further questions about the Transformation Fund, then please don't hesitate to contact our national team in the first instance, and hopefully we can direct you. And effectively a final reminder that the deadline for submission of the application or expression of interest for phase 2 for the Transformation Fund is the 16th of August. So have a lovely rest of the day, everybody, and thank you for joining us.